It's a very complex disease with a lot of complications, and it has a lot of burden. It has put a lot of burden on our society. You can see that. So what is diabetes? Diabetes mellitus is a chronic condition that is characterized by raised blood glucose level, which is also called hyperglycemia. So a condition which causes increased glucose is called diabetes mellitus. How is regulation of plasma glucose level done? It is a tightly regulated procedure. It by means of hormones. The main hormone which causes the decrease in levels is the plasma glucose is insulin, and those which causes increases the glucose levels are glucagon, epinephrine, cortisol, and the growth hormone. So only one hormone is responsible for down regulating the glucose levels, and that is insulin. And how does it do it? It does it by having a negative effect on the glucagon, so it decreases the release of the glucagon, and it causes uptake of increased glucose uptake by the muscles and by adipose tissue. It also affects the liver and decreases the glucose production. So whenever there is high blood glucose level, pancreas will cause the release of the insulin, which will inhibit glucagon and which will tell the liver to stop producing the glucose, while on the other hand will ask the muscles and adipose tissue to take up the glucose, and this in turn will reduce the blood glucose levels. Classification of diabetes. So diabetes is classified mainly as type 1 diabetes or type 2 diabetes. Type 1 diabetes was formerly called as insulin-dependent diabetes and juvenile onset diabetes, which was because it was considered to be a diabetes of younger age group of children, but now the concept has changed. Number 2, the type 2 is diabetes, which is a combination of insulin resistance with relative deficiency in insulin secretion. So there is resistance to the effect of the insulin, and which is followed by the loss of insulin production. So it was type 2, or in Roman 2 was given to it. Then it was previously, before that was the name was given to it was non-insulin dependent diabetes mellitus, because it was the one which was being treated by the oral hypoglycemic drugs at that time. Or it was initially, in the very beginning, it was named as adult onset diabetes because it was thought that it was the disease of the adults. But now with the obesity pandemic, we know that that type 2 diabetes can be seen in younger children, in children young as 2 to 3 years old. Then we have gestational diabetes, which develops in some cases of pregnancy and disappears after pregnancy. Then there are other types like secondary DM because of the chronic pancreatitis or acute pancreatitis or surgical procedures, and there's damage to the pancreas. So we have secondary DM or infiltration of the pancreas because, like in hemochromatosis. Or there is LADA and MODY. The LADA is latent autoimmune diabetes of adults, and MODY is majority onset diabetes of young. We are not going through them right now, and I will talk about them in my next lecture, which will be about the diabetes complications, and I will also touch these three over there, the gestational diabetes, LADA and MODY in that lecture. So what is the etiology of type 1 diabetes? Type 1 diabetes is an autoimmune disease which causes selective destruction of the beta cells by T cells. There are several antibodies which are acting against these beta cells, and these antibodies are like islet cell antibodies and anti-insulin antibodies, anti-GRAD antibodies. These are the antibodies which are in the body, and they affect them and causes the destruction of the beta cells. What exactly is the cause of this autoimmune attack? We don't know. Both genetic and environmental factors can play a very important role. So what can be the environmental factor? Many viruses have been considered as cause of this, like Coxsackie virus, mumps, and rubella. while like cow milk and nutrients is the cow milk which is being considered producing the antibodies. So babies, when you start giving them cow milk, they develop antibodies to cow insulin, and this insulin then with these antibodies then they start acting against the human insulin. So cow insulin is similar to human insulin, and then this results in attacking the beta cells. So that's how it happens. Type 2 diabetes is one because of the impaired insulin. So type 2 diabetes is a different entity. What happens is, in basically what is the cause of type 2 diabetes is that the insulin is being produced but it is not being effectively used by the body. So there is impaired insulin action, because of which there is decreased utilization of the glucose by the muscles and the adipose tissue, and there is increased glucose production by the liver. So this is because of the impaired insulin. The body keeps on producing the insulin, and it keeps on producing, and there are high levels of insulin. And due to excessive production of the insulin, the beta cells, they get exhaust, and there's dysfunction of the beta cells, or death of the beta cells takes place, and then there is impaired insulin secretion in patients. They move toward complete deficiency of the insulin, from higher level of insulin to complete deficiency of insulin in type 2 diabetes. Mechanism of hyperglycemia. So how does hyperglycemia occurs in diabetes? In absolute, there is, or type 1 diabetes, or in relative type 2 diabetes, when there is insulin deficiency, there is increase in hepatic glucose output and a decrease in peripheral glucose uptake and utilization. So the muscles and adipose tissue cannot take it up, and the liver keeps on producing it. So decreased insulin will cause decreased inhibitory effect on glucagon secretion, thus increase glucagon, and this increase in glucagon, it will in turn act on the liver, causing gluconeogenesis and glycogenolysis, which both will result in increase the plasma glucose level. So one way of having hyperglycemia is increased production of hepatic glucose under the influence of glucagon. Then there is decreased uptake, because if insulin is not there, muscles will not be able to take the glucose up. So decreased glucose and amino acid uptake and increased protein breakdown will lead to increased plasma glucose and plasma amino acids. So the glucose is not being taken up, so that's causing increased level of plasma glucose. The proteins are broken down, so this leads to increased plasma amino acids. Adipose tissue, decrease insulin, increase lipolysis, decrease lipogenolysis, and increase plasma fatty acid levels. So ketoacidosis, which takes place, is because of that insulin deficiency. So what is the characteristics of type 1 and type 2 diabetes in different scenarios? We have percentage of diabetic population, only 5 to 10% have type 1 diabetes, more than around 90% people have type 2 diabetes. Age of onset in type 1 is usually younger age group, less than 30 years, and in some adults, that is the LADA, which appears in the adults. And type 2, it is usually above the age of 40, and in case of the obese children. We also have another entity known as double obesity, double diabetes. It is a condition in which children who have type 1 diabetes, but because of their family dynamics, they put on weight, and as they put on weight, they develop type 2 diabetes as well. So the new category of double diabetes is also coming in. Pancreatic function usually is none in type 1, and in type 2 insulin is low, normal, or high. So it all depends on the stage of the type 2 diabetes. Pathogenesis, it is an autoimmune process in case of type 1. In type 2, it's the defective insulin secretion, or there's tissue resistance, so increased hepatic glucose outcome. So that there are many mechanisms in type 2. His family history is not strong in type 1, it is very strong in type 2. Obesity is not in common in type 1. Usually type 1 have weight loss, severe weight loss. Obesity is a common presenting feature of type 2 diabetic patients. History of ketoacidosis is often present. Type 1 mostly present. Type 1 diabetics mostly present with ketoacidosis. A young boy, a young girl for the first time at the age of 13 or 14 will be coming to ER with abdominal pain, and there will be ketoacidosis on investigations, and then the sugars will be checked, they will be very high. Very first presentation of these patients is ketoacidosis. Most of these patients in type 2 rarely except in stress or at the end when the type 2 reaches to the burnout stage, when the pancreas is completely burned out. That is the point when type 2 patients, they also start having ketoacidosis. So older age groups of type 2, we see very commonly ketoacidosis in them. Clinical presentation in type 1 is usually moderate to severe symptoms. The polydipsia, polyuria, polyphagia, the 3 P's are there: fatigue, weight loss, and ketoacidosis. While in type 2, the symptoms are mild. It is polyuria and fatigue, and diagnosis is on routine physical examination. Treatment: type 1, insulin, insulin, insulin. There is no other treatment besides insulin. You have to replace insulin in these patients, and then you do the diet and the exercise. In type 2, diet and exercise is the first thing. You have to make them lose their weight. Some people who are at the border of it, they will be just little higher levels, just having the 6.5 HbA1c. That's the cutoffs of the type 2 diabetes will improve with diet and exercise. And then the oral antidiabetics, insulin, and then newer anti-diabetic modalities. There are many. We have the diabetes, in the field of diabetes, the pharmacy, the therapeutics has boomed in the last few years, and there are many drugs to be talked about. So in epidemiology, it is, as I said, type 1 is due to pancreatic islet cell B cell destruction, predominantly by autoimmune process, develops in childhood or early adulthood. 10% of all diabetic patients, and as a result of exposure to genetically susceptible individuals to environmental agents. So एक genetically उसमें problem थी, और फिर कोई environmental agent, कोई virus आके लगा उसको, और उसकी वजह से उसकी susceptibility थी पहले से, और उसको exposure हुआ, और उसको type 1 diabetes की antibodies बनी, और वो destruction start हो गई. Type 2, it results from insulin resistance with a defect in compensatory insulin secretion. Insulin may be low, normal, or high. 30% of type 2 diabetic patients are undiagnosed. They don't know that they have disease because they're mild. 90% of all cases of diabetes are type 2 diabetes. Risk factors: genetic predisposition in type 1, and then virus or toxin exposures can lead to this. In type 2, family history important, obesity, physical inactivity, previously identified